Just like the lucky draw selected few lucky winners here, I got selected as a lucky speaker. The first speaker post-lunch who was supposed to carry the burden of keeping you all awake, that person chose to turn up late. So I was given this opportunity of trying to give you a little bit of a lullaby after the lunch. And thanks Anbu for kind of having me here. And it's been a wonderful session. And let me first start from by congratulating ICT Academy. I mean, you had such a powerful session. I was just talking. Not just about strengthening the new India by just giving back, but with a lot of power of collaboration is what we saw. I think you had a perfect audience and participants starting from the government, the corporate, the NGO sector, and the future. The Young India, the caretakers of Young India are the major institutes of this country. So it's a wonderful combination, sir. And I think just the right mix of audience makes this event a very wonderful event. And thanks for that. And I've been given this, the afternoon session is all about, okay, fine, we have a lot of success stories, but let's keep that to the end. Let's talk about some CSR perspectives, learnings, and particularly challenges, and challenges gives learnings anyway. And finally, some success stories. So that's been the theme of the entire, the post-lunch session. So I was asked to choose what you want to do. I thought I'll go with the theme. So me share some challenges and perspectives and learnings, particularly to strengthen and scale up CSR programs. So that's what is going to be the next. Okay. So before starting about the perspectives and challenges and so on, let me start with some guiding principle. And thanks to all our, we have the right mentors. Your chairman is also part of our board and emeritus vice chairman for Cognizant. And again, I had mentorship of Mr. Madhavan and then many eminent persons in the board. So one thing that we kind of came together and said that we should have some guiding principle. I mean, we are now actually about 14 years old. We are actually a teenager, so to say, from a Cognizant Foundation standpoint. But even when we were a toddler, I think I should appreciate there was a very clear focus saying that we should actually focus on 3 pillars, like many other corporates who presented in the morning. We chose education and healthcare and later included livelihood, and particularly within livelihood, skilling for guaranteed employment, for gainful employment. So that's exactly what we chose as 3 pillars. But we said we should actually really reach out to the most unreached and to the remotest corners. We are not from a manufacturing industry where we had a compulsion, or actually there are advantages for manufacturing to choose the CSR area for the geographical area around them. And we have presence in about 8 states in the country, and we started saying that in all the 8 states, in all the remotest part of these 8 states, we'll actually start working. And now we are actually, our board is actively saying we should go beyond these 8 states as well. There are a lot of Bimaru states and really more unreached community lays in the northeast, and we shouldn't restrict. Morning somebody raised the question saying that, is it a mandate to work only within your geographical area? All that the law says, it's recommended that you take the charity, let the charity begins at home, and therefore let it start with the nearby area first, but it is not a mandate. So we are actually even actively thinking, and now we are going beyond the 8 states that were Cognizant has presence as well. So for number 1, we said as a guiding principle is we should reach out to the most deserving and communities in the remote parts of this country. So that's our guiding principle. And if we have to do that, that means we don't have a geographical mandate in terms of our boundary. So to sharpen actually the impact and then to strengthen our program, what became very important for us, at least in the areas that what we choose, not just in the education, healthcare and livelihood, but within that we had to actually bring in that very sharpened focus. And I'll just talk about a little bit more on that, what type of challenges we had and how we had some learnings in actually bringing that, sharpening the focus. And of course, the third, very important guiding principle for us is that we should promote excellence. The very purpose of corporates coming here as part of this CSR law is not actually for giving money. It's not just for the fund share. There's a lot of, as a company, that we believed a lot on, individual social responsibility. We have reached out to close to about, 2.8 lakhs people, 2.8 volunteering hours is what we have actually clocked. 2.8 lakh volunteer hours is what we have clocked as an organization. We have close to about 150,000 volunteers in the company, impacting about 6 lakh people in the education, community welfare, environment, and as well as through our pro bono activities, which is our youngest, that's part of our outreach program. So we felt that it's not just about sharing our money, it's sharing our effort, but more importantly, it's also the mind share, the learnings that we have from the industry, from this sector, and that is something that we should actually take it back and we should actually promote excellence. And I was very happy when Ramco was talking about the 5S implementation in all the schools. We've also seen in some of our outreach schools where we have actually taken up some of our Six Sigma, the Green Belt program in schools very successfully. So these kind of culture, promoting excellence, if it is nurtured right from the school days, and when companies like Ramco is doing it, is actually very wonderful to see that. That kind of promoting excellence in all that we touch upon, that's something that we took it as a very, very important principle. And of course, like, IT industry is a very young industry in that sense. We are standing tall on the shoulder of many other industries. Most of our quality philosophies we borrowed, we kind of reused. We didn't reinvent from the manufacturing sector. Similarly, if you take bulk of our project management, program management, we always look upon construction industry and see that how well they have their estimation. For every square feet, they're able to tell the cost very accurately. And estimation is always an art and not a science when it comes to software. So we always struggled and looked at and modeled ourselves with industries which are very matured. So the same thing is what we wanted to do when we actually wanted to get into the service sector as well. Here, forget about estimation, it's, just the concept of data. The previous speaker talked about data. Like that's actually either non-existent, or if it exists in a very inconsistent form. So both were a challenge. So how do we promote excellence in this entire sector? So that happened to be our guiding principle. And of course, we also wanted to promote technology-based innovation, because that can solve some of these problems as well. It can also be part of the solution. So these were the three as we took it as the guiding principle. And this is what we used actually to kind of started sharpening the focus and strengthening our programs. So if you have to strengthen our CSR programs, first and foremost question that we have to answer is whether the current program is effective, right? Unless you don't want to strengthen. When we started in the three sectors with the three pillars, which is the education, healthcare, and livelihood. And we actually were doing many projects and slowly started focusing, and we started coming up with the concept of flagship program, started promoting higher education as Mr. Lakshmi mentioned, focusing on the future, building that skills and promoting excellence there. So we started coming up with the scholarship program for engineering. And similarly in healthcare, we picked up actually preventing avoidable blindness as actually a program. And very beautifully, Mr. TVS spoke in the morning about the Potter model. When we actually got introduced to Potter and Howard model, I still remember fondly the discussion that I had with Lakshmi, saying that it has to be connected to the business. Lakshmi said it is fine, but it still has to be connected to the country first. So the healthcare is not necessarily something that's connected to an IT industry. Of course, we do service healthcare as actually our customers. That's one of our very strong vertical within Cognizant. But what is important for us when we chose healthcare, and particularly avoidable blindness, was not necessarily because that we can actually, we are part of that industry and therefore that we have some solutions to offer, but we definitely felt that the need is very, very strong from India standpoint. Just to give some figure, about 280 plus million people actually worldwide have distance-related visual impairment. And of that, about 39 million or something are completely blind. And 90% of this burden is coming from developing countries. And India has the dubious distinction that we have world's 1/3 to 1/4. Now, why? Because we started with 1/3 and now we are limping towards by reducing our burden of blindness, and we are becoming like the 1/4 in the country. That's a part of our Vision 2020 goal. And the saddest part, and also a tonic for us, is the 80% of this visual impairment is actually avoidable. So which means that makes it as a very compelling case for India. Forget about whether we have experience or expertise. We thought, okay, we'll jump in there, and that's how we started preventing avoidable blindness as one of our focus area. And so fine, what do we do within the preventing avoidable blindness? I'll just deviate here and distract you with a small story. This is actually a story of a girl called Dia. Of course, the name is changed for protecting the privacy. It's about 10-year-old. All that she had was that she had this squint eyes, and in rural area, particularly in Nashik, in Maharashtra, where the awareness of eye health is so poor. And initially, she was nicknamed as Kani. And she thought she's actually a cute little nickname is what she's carrying, and she was very bubbly in spite of all our eye health, and then which was affecting our education as well. Most of the time that, in Indian education, people are thinking that children have learning disability in the classroom, but if you just look at it, the number one cause for learning disability is actually eye health. When they are not able to see very well in the classroom, they get left behind. So that was a case of this Diya as well. And then as she started growing up, that is when she realized that she's getting a special treatment, and Kani is not just a cute little nickname, but that means that her eyes are looking very different. So that started affecting her morale, her image, and so on. She was almost on the verge of dropping out of the school, saying that I won't go to the school type. But thankfully, that was when a school screening program was initiated by Tulsi Eye Hospital in Nashik. And then she got screened. And earlier, before that, her parents, when she was so adamant that she's going to drop the school, her parents did take her to a nearby hospital and realized that it's going to be a costly surgery, and they gave up as well. And this Tulsi Eye Hospital, as part of the school screening program, they actually picked up this case and said that, okay, fine, we'll do the surgery, and now the surgery is done, and this is the before and after her eyes. And now she's very happy, and then the exclamation she did is, I felt like a fairy came and actually my wish came true. And this Tulsi Eye Hospital is actually a partner of Mission for Vision, and we don't go and directly partner only with hospitals. That's what we started doing earlier. Later, we realized the need for multiple people coming together and collaborating. And today, we are actually, some of our programs are effective, and with the sharpened focus is also possible because we have multiple credible partners. In this case, Mission for Vision is our knowledge partner, and Tulsi Eye Hospital in Nashik is actually our implementation partner. So Mission for Vision came back with the processes of how to do systemically school screening. Why school screening? I talked about 80% of the blindness being avoidable. But imagine, particularly the child-level blindness, it's not only the number that's big, but actually their entire years of life, we are actually making them, avoid that blindness or visual impairment is kind of, avoid them and give them a full life. So the school screening program is something we have started with the Mission for Vision and the Tulsi Eye Hospital, and this is the story of Diya. And now let me go back to, it's not just only about the young, children. This is actually a story of Surjit, who's about 42 years old. And this is a very sad story. In spite of being at his 42nd year, he was working as part of a sweet maker shop in some rural West Bengal, Namkana. And when he actually suddenly started feeling that, his visual impairment is kind of not making him work as effectively at the 42nd year. He's already a breadwinner for a 6-member family. And he thought that he's actually losing his eyes, and his boss was obviously unhappy. A sweet maker shop, somebody is not having a good eye health, working on the food industry is very dangerous that way. So thankfully, one of his friends said that, okay, there is a vision center that's nearby where you can actually go back and at least have a check. So he actually all that he did was he got his spectacles done, that's all, in the 42nd year. It's not, till the time, he had been living with that. And now he's so happy that he's able to read and write. And he's happy because his boss is happy with his work. And that's what he's come back and explained. So how this is possible? I'm very thankful, I think Eta Sintel was talking about the importance of measurement. When we started these projects, we also started these as one-off projects here and there. But what we realized is we had to pick and choose the projects which is most effective. So we started with many others, how to do measurements. I'd been in this kind of role where I had wear this art of, even in the IT side of it, trying to go back and implementing measurement program. And it's not easy. Even in the corporate sector, it's not easy. But doing that in the development sector, I just realized that how more it is important and as well as how challenging it's going to be. The reason being, first, many people are here carried by their heart. They want to go jump and do the work. When you talk about the numbers, it's also to that extent thinks that, oh, you're not trusting me. I'm actually creating this kind of an impact. And just like how I told stories, all that we were hearing were stories. They talk about individual anecdotal evidences and telling stories, saying that this is what is successful and so on. We said it is fine, it's perfect. But how do we know which program actually gives the maximum return for the same money? Rightfully. The money is not something that, it's coming in the tap, and we do have limited resources. And that's an opportunity for us to be more, come up with more frugal innovation. How do we make it more effective? For the same money, can we actually reach out to more people? How do we bring the efficiency in the whole system? Are we picking up relevant projects? And are we really reaching out to this most deserving society? Is it this project is relevant in that area? And more importantly, is this project sustainable? Just to tell in this Vision Center case, This is a very beautiful case, like where this project is actually completely sustainable in 3 years. We supported setting up of the Vision Center along with, in this case, as part of the OEI, Operation Eyesight International, India. We started with 2 centers, now we have set up 7 centers in the 2 states, which is Karnataka and West Bengal. And we have also set up one more center, which is the same Nashik, along with the school screening program with Mission for Vision. We've also set up a Vision Center. These are remote areas where the eye health is kind of completely non-existent. So these Vision Centers, once we set up the Vision Center, and of course OE has a very perfect model, they have actually evolved it over many number of years as a Calgary, Canada-based NGO, and they don't charge for their knowledge partnership, and actually like, there is the knowledge that they bring in, the fund that we bring in, and we collaborated. And when we started setting up that center, the idea was that, okay, all the model of how to set up the center, what type of quality parameters, how it has to be designed, even the Vision Center, everything was actually, the plan was to the detail, last level detail. They had the knowledge partner, all that. And that was actually the reason why we went with such knowledge partners and started doing this multi-party collaboration. And in 3 years, a small charge is actually levied for the community. The spectacles do not come free. I mean, they charge a minimum. But over the period of 3 years, they become self-sustainable. The operational cost is actually maintained by the community paying. So an healthcare is actually a very beautiful model where you have a paying customers and where you have a non-paying customers, depending upon the need, and depending upon their need, they charge it appropriately and so on. This is actually a very successful model where the community is actually self-sustaining it. Were there challenges? Of course, yes. For example, like when we started with this OEU or OEI, which is the India part of the OEU, is that they came back with another tech partner and they said that everything is going to be through systems, where their last implementation partner, the local vision centers, every single sales they make, every single, like diagnostics that they do, everything is actually fed into the system, and how the reporting is going to happen and how we can have all that. And they actually bet on a social entrepreneur who's a tech partner, and we said, fine, we'll go with, and we don't actually necessarily build every time that Cognizant pitching in and doing the system. We always go with other social entrepreneurs who are in this space when they come up with a solution, because that's a lot more scalable, because they take that solution, there is a financial model behind them, making it successful and so on. So we went with that model, and unfortunately that particular entrepreneur took a different path, and they kind of abandoned the system in between. But all these 7+1 is still running, but with manual systems. Now we are in the drawing board back again to discussing, now we want to scale up more of this program. Now we are seeing that, okay, let's identify one more tech partner, because we really believe that it has to be through the tech, and we don't want to do the burden of reporting everything through manual systems here. So there are challenges, there are learnings, but this multi-party collaboration and credible partnership really works. And how can we get into these credible partnerships? And we were also, like many other corporates, just like when government was talking about, Dr. TVS were talking about how so many proposals and innovative proposals come in. Even as actually part of the foundation, you feel sometimes you're blessed. You're surrounded by so many passionate people, NGOs coming and pitching in so many solutions. Sometimes it's so confusing. And sometimes it's really nervous to come to forums like this, because you're worried about the number of calls and the number of visiting cards, and for you to keep up that commitment of giving them the call back. But the advantage at the same time is there are so many solutions, so many people wonderfully putting their brain together and for us to choose from. But if you sharpen your focus and want to work on specific areas, half the problem is solved. Because you are able to come back and say that this is exactly what we want to. And we are able to go back and with our experience come back and say that this is the kind of measurements that we need to have in place. We should say for the same money, what is the input that is going in, for that what type of processes you do, what type of activities you do, compare a and a B and a C, and see that where the money is leaking, is it an efficient system? Is it reaching out to that many output? Is it the output is not guaranteed because the population is thin or densely populated, or is it because of the lack of efficiency in the system? And at the end of the day, is it effective? Is it really helping the people to get the real benefit what they want to? All that was actually possible because we have that sharpened focus. As I said earlier, the relevance is important. In India, with like 1/4 of the world blindness and visual impairment being in India is a very, very important cause. And within that, we just didn't leave it there. Within that, we chose these are the areas. Child blindness is important for us, therefore we will do school screening, as well as we'll do one more, that's the retinopathy of prematurity. When we started that program, that's again an interesting program. Only Queen Jubilee Trust, as part of the Queen Elizabeth's, the Jubilee Year celebrations, they were the only one in India which was working on for promoting the cause of, or at least creating the awareness on retinopathy of prematurity. This is a very interesting thing. A lot of work in India happened to actually reduce the infant mortality. But the flip side of it, a lot of babies who are less than 1 kg are getting saved. But at the same time, that's actually affecting their high health. And within that, first 1 month or 2 months, and it's actually a big percentage of within the people who are in the NICUs, which is the neonatal intensive care unit, a very large percentage actually can turn blind and can actually develop ROP. So we started this program along with Arvind to start with, and now we are extending this program again along with Mission for Vision and HP Desai, and as well as with LVPI in 3 states. And one of the states is also going to be the state where Cognizant doesn't have a presence. Andhra, Telangana, and Odisha, since they happens to be contiguous states, is in all the 3 states we are going. And in ROPs, actually sustainability, it's very difficult to get it back from the community. It's not that the communities you can charge. But there, what do we do for sustainability? Okay, we look at how can we make first this program, create awareness in the community and then create so that the government can actually pick it up and do. As we speak today, actually I was very happy that one of our projects is getting delayed because of Mission for Vision HV Desai. The reason being, the 3 districts that we chose, the government has come forward and said one district, they will take it up and do it ourselves. We were so happy that, okay, fine, the project is delayed. Either we can choose another district or we can complement the efforts of the government. So we are actually going back to the discussion back along with the government. There, the scalability is coming because, we are trying to show, we can't take the entire credit. Of course, Queen Elizabeth Trust did a lot of work on creating the awareness. But with the first program with Arvind and following program with, Mission for Vision and LVPI, now at least the awareness is getting created on ROP, and now government is actually picking it up and scaling it up. So that is the kind of program that we want to work on. And set up a vision center, I already spoke about. We have about 8 centers running in the 3 states. And now we are scaling it up, but with an appropriate tech partner now this time. Earlier we left it to an NGO partner to do that. And of course, we continue to do the capacity building in the various tertiary centers of which works on the ICANN. And over all this, we start calculating the impact over the last 7 years. The reason being, some of the programs we started the first 3 years, and after 3 years, we do an impact study, and if it's successful, we extended the program, and therefore, some of these programs are running for the last 7 years, and that is the reason why we get a cumulative metric. Some of our programs are even 7 years old. So we have been able to reach out about 1.6 million lives, especially for avoidable blindness. So that's our sharpened focus, and which, with the sharpened focus, we are able to get the right partners, and that right partnership and the technology and processes in place is actually yielding us the result. So it's not just about the number of people with whom it is touched. We also have metrics saying that how many of them actually could have turned blind and how many of them had the intervention at what age, and therefore how many blind years were averted. So that is the kind of a metrics and measurement that we have because of the sharpened focus. And second is again, this is very close to our heart. It's not that strengthening always means we are narrowing down our focus area. This is a focus area where we expanded. I think when all our founders, including Lakshmi mentors, they were there. The first flagship program of Cognizant was the scholarship program. For access to higher education was a big challenge because we all know that higher education, a bulk of that is actually with the private institutes. And again, even in the government institutes, the fees is not so subsidized. And for people who are from the below poverty line, it's not something that's an easy walk into getting into the higher education. So we started with engineering education because we are from an IT, and we wanted to give back into the engineering community and want to build really people who had the aspiration to be part of the future engineering team to be there. That's what we started with. Then we slowly realized that we should look beyond STEM, and we should look for courses which are nation building. And these are the 2 scholarships which we have just started. This is our youngest program we started just last year. The first program is actually a scholarship for visually impaired. We realized a lot of the visually impaired people actually, they have this aspiration to study. And in fact, many of them want to aspire to become a teacher. There is a quota for them to become a teacher, but unfortunately, it's not that that quota is getting filled up as well. That's what we are given to understand. So we started this scholarship program for visually impaired, and this is actually Gauri from Madras School of... so this one, actually, when we started this scholarship, we also realized that, it is not just about the scholarship. We should also extend some skilling program. So this is a partnership with Help the Blind Foundations. We pushed that NGO and said that we believe that even after the degree, people are begging on the streets and it shouldn't happen. So what should we do for that? So though we have some separate skilling program for gainful employment, in this case, we partnered with Enable India and Help the Blind Foundation. Enable India is the knowledge partner here, where the skilling program is actually done during the second year and third year. So along with their scholarship, also their mobility training, all the basic employability related training is something that is offered over the period of the next 2 years. So we hope that these, the young kids, when they kind of turn out after their graduation, they actually walk in with more confidence and get into more meaningful jobs. And not just that, we also realize that with the RTE Act, like the inclusive school is not just a dream, it's a mandate. Every school has to become an inclusive school. And all these special educators, they are actually shared across multiple schools. But if you look at the ratio of special educators to the actual need of the children, it is abysmally low. The number of special children in the country is so high, whereas the number of trained teachers or special educators is abysmally low. And when you have these special educators, they either specialize on visual impairment or hearing impairment or MR. But it is the same special educator who gets shared across multiple schools, irrespective of the kind of inclusion that the particular school has. And that is the reality. So we thought the need of the hour is actually to promote more talent and bring more people into the special education. So we kind of, all our programs, we always promote excellence, merit, as well as means. So we look for institutes which have a good NAC rating, and as well as these students who have a very good score, and as well as from the underprivileged community. In the case of the special educators, we realized that many of these colleges do not have NAC rating, but they are affiliated under RCA. So then we started looking at some more research and saying that why is that RCA affiliation is important. So then we narrowed down, and we also looked at how long these courses are run. And some of these institutes, when we personally visited, it's such a heartwarming story. How the principals who are running, they themselves have done the special education course and they have come back and giving back to the society. And this is one girl, which we didn't reach out to her asking her, like, what is that you? She wrote immediately after she received a scholarship. She just sent a note to us saying that I just really couldn't believe my eyes. She said, typically we have heard people about giving scholarship for people who are visually impaired and people who have, who are persons with disabilities. But somebody whom you are thinking that we will be contributing back to them and therefore identifying us as actually social champions and future leaders is something. And she said otherwise she was actually meeting her expenses by taking part-time tuitions. Even that was not meeting her expenses. She was so happy that she received this scholarship. So these are the two stories, and this is actually how we expanded. We started with promoting excellence for engineering institutions, but extended it for inclusive education and as well as for, and of course, apart from that, we also now have scholarship for social work, and that is for graduate study. People who, when so many NGOs, we thought that one indirect way of building capacity in this country is actually by giving very qualified professionals for this sector. Therefore, we started reaching out to people who are pursuing their graduate study in either social work or development management, and we wanted to attract talent there so that people with more credible credentials and experience and expertise actually come back to this sector. So that's again 800 plus each year are getting impacted across through the various courses. And finally, of course, the livelihood. And this is an interesting story as well. We started initially with livelihood, which is skilling for underprivileged youth with guaranteed employment. If you ask me to talk about challenges here, I can talk a lot. Okay. Always we had this metric. This is one thing that when I went and met Mr. Madhavan, I said, this is a program which has all the metrics in place. Saying that because unless they have a 70% guaranteed employment, the project itself doesn't even move to the next stage. We just not only skill them, we also ensure that they were 70% employed in the sector in a meaningful way. But later, after the 4 years, we started digging the data and started seeing how many of them are retained in that job after the first year. And that's interesting. It's not still bad. It's about 50 to 60. When we say 70% of the trained or who are getting actually placed, about 50 to 60% of the people are people who actually retain. And that also varies from location to location, from sector to sector. Services sector, though many people aspire to do skilling there, and that is the sector where the attrition is also high. Whereas in engineering and manufacturing sector, at least they continue for long. And if you look at so we started looking at, and we also started looking at how do we bring in inclusion? How do we bring more women, persons with disabilities? So when we started picking up, this was actually one case of Sarika, who's actually 70% orthopedically handicapped. Of course, she, till the time that she got married, she didn't realize that she had to earn, but she got married to a construction laborer, and her child was actually was struggling to get quality education, and therefore She enrolled herself in a school and a college, and she completed her education. And after that, along with CF and Sarthak collaborations, as part of our skill training program, she actually enrolled herself in the skill training, and now she's working as a retail assistant. We realize that the people who are with differently abled, like once they are actually trained and placed, it's not just about the placement is good, the retention and attrition is actually extremely low. It's not that we are actually, leaving out the disadvantaged youth. There we are trying to do differently. We are trying to promote more ITA education and trying to do differently. So each one of these metrics is actually will help us back to see whether our program is effective, whether it is sustainable, is making the meaningful intended impacts. So with that, so this is our 19,000 people. So this is our focus that I talked about, the 3 pillars, not just the pillars, but within that what program that we do. Only when you have a blueprint of what the scope of the work is, we can be very clear on what to measure, what should be the processes, what should be the systemic changes that we can bring in, and what type of partnership can work. So in each of these areas now, we can say that we have reasonably good reliable data, because we are still dependent on a large ecosystem which is partly manual and partly automated, but at least that's actually helping us to, with the sharpened focus, that's helping us to do that. So this is some of our approach and learning. Definitely we should set the agenda very, very clear and define the goal and the impact up front. It's not that for everything we should start with a benchmark. Sometimes the new innovations that we nurture, I couldn't talk about a lot. We work on 2 different projects on healthcare, where we worked along with the IIT Madras. Those are very difficult to start with a measurement, but we know that the innovation is going to actually pave a big way. But since we already had metrics on other projects, we know at least with this innovation, that impact should be much higher than that, and that is what we started chasing. And similarly, with this, actually, we are able to develop some deeper relationship with the NGOs. So, and with all that, we've impacted about 3.4 million lives in the last 7 years. It's not a big number considering India's population, but at least for us being in the teenage, about reaching out about 28 lakh in the last 7 years in healthcare, or about 500,000 in education, or about 19,000 in livelihood. And that's a one-off projects we did after the Chennai floods. Adopted about 9 different villages for rebuilding the communities holistically. So with that, I kind of complete.